So how do you think COVID has changed people's views on their own healthcare and the need for healthcare workers?
I think like in all of our minds, it just healthcare workers rose to being more and more important. I'm so excited. I actually 2 months ago had my second child and got to experience again, like refresh in my mind, like the importance of healthcare workers. Like when you go through an experience like having a child, if you really start to appreciate the people that dedicate their lives to helping others and making sure that people feel comfortable in these medical experiences and these procedures and supported, and like the compassion of our medical assistants and nurses that were coming to check on us all throughout the process is just like, it's so touching. I left so inspired, and to be able to provide the training for people to start in this industry is just such an honor. It's so exciting. And yes, we're going to need more healthcare workers. We already do. We have a shortage of them. And so for people who have compassion and want to help people and want to have a stable career, it's such a great option. It's such a great option. And you can start entry level with one of the training providers here and get an entry level position and work your way up. For us, we focus a lot on dental assisting, and then many of our students become dental hygienists. And then you do make a really good money in hygiene. And then some of our students start as medical assistants and want to become nurses or doctors someday. And you can make that progression. You don't have to make a decision, when you're 18 and make a $40,000 investment and decide I'm going to be this career my whole life. Instead, you could pay a tenth of that, get started in healthcare, and decide, like you were saying before, do I want to become a doctor? Do I want to become an RN? Do I want to specialize in different practices? And you get all that experience. And then when you do pursue higher education, you know exactly what you want. So I think what we're working on, this group and with Climb's help, I think we're really going to transform how education works in this country. And we're so excited about it. I think it's really important. We're going to help more people get access to jobs without student loan debt. And I think we're just going to be the force that helps us get the healthcare workers that we need to serve our population with great healthcare.
That's great. Yeah. I mean, what could be more important, especially right now? But also, I think the time is right for, people are really questioning their return on investment of their educational dollars, right? Questioning, what do I want to get out of higher ed? What do I want to get out of my sort of education that I get after high school? And, the answer that keeps coming up is like, I want to make sure it leads me towards some sort of career, right? And so I think you guys are doing a really good job of, checking that box and doing it in a low cost and efficient way so that people can really test it out.
Absolutely. It's more about a job than a degree for
Right.
many of the people that we serve. And then once they get that job and they get this stability, they can support themselves and their family, then it's easy to add a degree later.
Right.
You don't have to make that decision when you're 18.
Right.
It's important.
You make a lot of decisions when you're 18. As a former 18-year-old.